Let me ask you something. If I told you that sitting in your kitchen right now, maybe in your pantry or your refrigerator, are foods that could shrink your prostate, reduce that urgent 3 a.m. trip to the bathroom, and give you back the kind of sleep you had 20 years ago, would you believe me? Most men would not. Most men have been told this is just what happens when you get older, that a swollen prostate is the price you pay for being a man over 60, that the only options are a prescription pill, a catheter, or a surgical procedure that leaves you crossing your fingers for the next decade. But what if I told you that science, real peer-reviewed science, tells a very different story? What if the reason your prostate is inflamed, enlarged, and making your life miserable has everything to do with what you are or are not putting on your plate? Not just in a general, healthy eating way, but in a very specific, targeted, biological way. Because your prostate does not swell for no reason. There are pathways inside your body right now, hormonal pathways, inflammatory pathways, cellular pathways, that are either feeding that growth or shutting it down. And certain foods work directly on those pathways. I am going to show you exactly which ones, why they work, and how to use them starting today. I'm Dr. Emmy Takita, a urologist with over 30 years of experience helping men like you regain their energy, performance, and vitality. If you're new here, welcome to the channel. Before we go any further, if you're serious about protecting your prostate, staying strong, and living without fear, hit that subscribe button and turn on notifications. I share real information backed by real science for men just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0, so I know how to help you better next time. Now let's get into it. Before we get to the foods, I need to spend a few minutes explaining what is actually happening inside you, because once you understand the mechanism, everything else clicks into place. And more importantly, you will understand why these foods are not just healthy choices, but strategic ones. The prostate gland sits just below your bladder. It surrounds the urethra, which is the tube that carries urine out of your body. When you were in your 20s and 30s, that gland was roughly the size of a walnut. Somewhere after 40, many men start to experience what we call benign prostatic hyperplasia, or BPH. That is the clinical name for a prostate that has grown larger than it should. By age 60, studies suggest that roughly half of all men have measurable prostate enlargement. By 80, that number climbs to nearly 90%. Now, here is the part most doctors do not take the time to explain in a short office visit. BPH is not simply about aging. It is driven by specific biological forces, and the most important ones are hormonal imbalance and chronic inflammation. As men age, testosterone levels decline, but another hormone called dihydrotestosterone, or DHT, often remains elevated or even rises relative to testosterone. DHT is the more potent form of the hormone, and it binds directly to prostate cells and tells them to grow. Meanwhile, estrogen levels also rise in aging men due to increased body fat and declining liver function. High estrogen further stimulates prostate tissue growth. On top of that, chronic low-grade inflammation is feeding the fire. Inflammatory compounds called cytokines and prostaglandins circulate through your bloodstream and directly stimulate prostate cell proliferation. So you have a hormonal problem and an inflammatory problem happening at the same time, and the modern Western diet is pouring gasoline on both. Processed foods, refined carbohydrates, seed oils, excess sugar, and red meat in large quantities all raise inflammation and worsen hormonal balance. But the reverse is also true. Certain foods reduce DHT activity, block the estrogen signal, cool the inflammation, and even shrink the prostate cells themselves. That is what this entire video is built around. So let us start with the first one. The first food on this list is one you probably already like, and the fact that it works so well for the prostate is a genuine gift. Tomatoes. More specifically, the compound inside tomatoes called lycopene. Lycopene is a carotenoid, a plant pigment that gives tomatoes their red color. It is also one of the most potent antioxidants found in food, and here is the remarkable thing about it. Of all the tissues in the human body, the prostate accumulates lycopene at higher concentrations than anywhere else. Your prostate was literally designed to absorb this compound. What does lycopene do once it gets there? It does two critical things. First, it significantly reduces oxidative stress in prostate tissue. Oxidative stress is what happens when free radicals damage your cells faster than your body can repair them. In the prostate, that damage is one of the signals that triggers uncontrolled cell growth. Lycopene neutralizes those free radicals before they cause that damage. Second, and this is the part that impresses me most as a urologist, lycopene has been shown in multiple clinical studies to reduce PSA levels. PSA, prostate-specific antigen, is the marker we measure in blood tests to monitor prostate health. A meta-analysis looking at lycopene intake and prostate outcomes found consistent reductions in PSA among men who consumed lycopene regularly. Now, here is the key that most people miss. Raw tomatoes give you some lycopene, but cooked tomatoes give you far more. Heat breaks down the cell wall of the tomato and releases lycopene in a form your body absorbs up to 4 times more efficiently. Tomato paste, tomato sauce, canned crushed tomatoes, all of them are more potent sources than a fresh slice. Add a drizzle of olive oil alongside them because lycopene is fat-soluble, meaning fat helps carry it into your cells. Aim for a half cup of cooked tomato product 4 or 5 times a week. Stir it into eggs, simmer it into a simple sauce, or use it as the base for soups and stews. This is one of the most effortless upgrades you can make, and your prostate will feel the difference over time. What most men do not know about this is that countries with the highest tomato consumption, countries like Italy, Greece, and Spain, consistently show lower rates of prostate disease in population studies. That is not a coincidence. That is a pattern, and it points directly at lycopene. The second food takes us back several centuries. Pumpkin seeds have been used in traditional medicine across Eastern Europe and parts of Asia to treat urinary problems in men for generations. For a long time, the medical establishment dismissed this as folklore. Then the research caught up. Pumpkin seeds are rich in zinc, and the prostate gland contains more zinc than any other organ in the human body. Zinc plays a direct role in regulating DHT, that potent testosterone derivative we talked about in Section 1 that binds to prostate cells and tells them to grow. Research shows that zinc deficiency is strongly associated with higher DHT activity and faster prostate cell proliferation. Restore the zinc, and you dial the DHT signal back down. But that is not all pumpkin seeds bring to the table. They contain phytosterols, plant compounds that compete with DHT for the same receptor sites on prostate cells. Think of it this way. DHT needs to bind to a receptor to deliver its growth signal. Phytosterols dock at those same receptors first, blocking DHT from getting through. It is a bit like parking your car in a spot so the delivery truck cannot pull in. Pumpkin seeds also contain beta-sitosterol, which has been shown in clinical trials to improve urinary flow rate and reduce the sensation of incomplete bladder emptying. These are two of the most frustrating symptoms men with BPH deal with every day, and a small handful of seeds addresses them at the root. A 2016 study published in the journal Nutrition Research and Practice followed men with BPH who consumed pumpkin seed oil daily for 12 weeks. At the end of the trial, they showed significant improvement in urinary symptoms and a measurable reduction in prostate volume compared to the placebo group. A small handful of raw or dry roasted pumpkin seeds daily is your target, about a quarter cup or roughly 30 grams. Eat them as a snack, scatter them over a salad, or stir them into oatmeal. Just avoid the heavily salted or flavored versions, as the additives can work against the anti-inflammatory benefits. And keep in mind, consistency matters more than quantity here. A daily small serving beats an occasional large one every time. Before we go any further, if you are learning something valuable here, something you wish someone had told you years ago, take 5 seconds right now and hit that subscribe button. We are adding new videos every week on prostate health, men's vitality, and the science of aging well. Do not miss what is coming next. Now, I want to bring in two foods together in this section because they work through a similar pathway, and when you understand that pathway, you will want to use both of them. The first is green tea, specifically the catechins inside it. Green tea catechins, and the most studied one is called EGCG, epigallocatechin gallate, are among the most researched plant compounds in prostate science. EGCG has been shown to inhibit the enzyme 5-alpha reductase, which is the exact enzyme that converts testosterone into DHT. When you block that enzyme, less DHT is produced, and less DHT means less stimulation of prostate cell growth. This is actually the same mechanism targeted by the prescription drug finasteride, one of the most commonly prescribed BPH medications. The difference is that EGCG does it without the side effect profile that causes many men to stop taking that drug. A Japanese epidemiological study that followed over 49,000 men found that those who drank 5 or more cups of green tea per day had a significantly lower risk of advanced prostate disease compared to those who drank less than 1 cup. That is a powerful signal from a very large sample. 2 to 3 cups of green tea daily gives you a meaningful therapeutic dose. Brew it in water that is just below boiling, not rolling, because very high heat degrades the catechins. Let it steep for 3 to 5 minutes and drink it without milk, as proteins in dairy can bind to catechins and reduce their absorption. Now, the second part of this section, broccoli and the cruciferous vegetable family, which includes Brussels sprouts, cauliflower, cabbage, and kale. These vegetables contain a compound called indole-3-carbinol, which converts in the stomach to diindolyl methane, or DIM. DIM is remarkable for what it does to estrogen metabolism. It shifts how your body processes estrogen, pushing it toward less potent, less stimulating metabolites, and away from the forms that promote tissue growth in the prostate. Remember, elevated estrogen is one of the 2 major hormonal drivers of prostate enlargement. DIM does not lower estrogen, it reroutes it. It essentially turns a hormone that was feeding your prostate growth into a safer, less active form. Add 2 to 3 servings of cruciferous vegetables per week to your diet, and you are directly modulating one of the root causes of BPH. Steam them lightly, roast them, or eat them raw. Just do not boil them for extended periods, as water-soluble compounds leach out into the cooking water. We are coming to the final stretch now, and I want to close on what I consider the most underestimated driver of prostate problems in men over 60, chronic inflammation. Everything we have talked about so far, the DHT, the estrogen, the oxidative stress, all of it is made dramatically worse by an inflamed internal environment. And that inflammation is something you eat your way into and can eat your way out of. Flaxseed is the first food in this section. It is the richest plant-based source of alpha-linolenic acid, an omega-3 fat that your body uses to produce anti-inflammatory compounds. But flaxseed brings something else that almost nothing else does in the plant kingdom: lignans. Lignans are phytoestrogens, meaning they weakly mimic estrogen in the body. That might sound counterproductive given what I said about estrogen and prostate growth, but here is the nuance. Lignans actually compete with the more potent estrogens for receptor binding. They occupy the receptor without activating the strong growth signal. They are essentially blocking the more harmful estrogen from getting through, the same phytosterol parking lot mechanism we discussed with pumpkin seeds, but applied to estrogen receptors this time. A study published in the Journal of Urology found that men with BPH who supplemented with flaxseed lignin extract showed significant reductions in lower urinary tract symptoms over 6 months. 2 tablespoons of ground flaxseed daily is your target. Whole flax seeds pass through your digestive system largely intact, so grind them or buy pre-ground flax. Stir it into yogurt, add it to a smoothie, or mix it into oatmeal. Store it in the refrigerator because the oils oxidize quickly at room temperature. Alongside flaxseed, I want to mention fatty fish, specifically salmon, sardines, and mackerel. The EPA and DHA in fatty fish are the most potent dietary sources of anti-inflammatory omega-3s your body can use directly. They do not need to be converted the way plant-based omega-3s do. They go straight to work reducing the prostaglandins and cytokines that drive prostate inflammation and cellular proliferation. 2 servings a week, roughly the size of your palm each, gives your body a consistent supply of these compounds. Let me tell you about a patient I will call Harold. He was 67 years old, a retired engineer, and he came to me because he was waking up 4 times a night to urinate. His quality of life had deteriorated so significantly that he had stopped traveling with his wife because he was afraid of being too far from a bathroom. His PSA was elevated, his urinary flow was poor, and he was miserable. He was already on a common BPH medication, but felt it was not doing enough. We did not stop his medication, but we built a food strategy around it. Cooked tomatoes with olive oil most days, a daily handful of pumpkin seeds, 2 cups of green tea in the morning, 2 servings of broccoli a week, ground flaxseed in his breakfast every day, and fatty fish twice a week. Within 8 weeks, Harold told me his nighttime trips had dropped from 4 to 1. Within 6 months, his PSA had declined, his urinary flow had measurably improved, and for the first time in years, he and his wife took a 10-day trip to Portugal without anxiety. The foods did not replace medicine. They addressed the underlying biology that the medicine alone could not reach. Here's the truth I want you to walk away with today. Your prostate is not aging in spite of you. It is responding to the environment you create inside your body, meal by meal, day by day. The enlargement you are experiencing is not a random punishment. It is a biological response to inflammation, hormonal imbalance, and oxidative stress. And every one of the foods I have shown you today targets one or more of those drivers directly. Cooked tomatoes for lycopene and PSA reduction, pumpkin seeds for zinc and DHT blocking, green tea for 5-alpha reductase inhibition, broccoli and cruciferous vegetables for estrogen rerouting, ground flaxseed and fatty fish for shutting down the inflammation engine. You do not have to do all of this perfectly or all at once. Add 1 food this week, stack another one the next week. Give your body 2 to 3 months of consistent input, and you will begin to see and feel real changes. And please, if you are on any medication for your prostate or blood pressure, loop in your doctor as you make these changes. Some of these foods genuinely move your numbers, and your physician needs to know so they can monitor you properly. Bring this list to your next appointment and ask about it. Now, there is one more thing I want to address that this video could not fully cover, and that is what is happening to your prostate at night, specifically why so many men find their symptoms are worst between midnight and 5 a.m., and what targeted steps you can take just in the evening hours to dramatically reduce those nighttime trips. I have a dedicated video on exactly that sitting right here for you. Go watch it next. I will see you there. Dr. Takeda.